a motivation to bring patient partners in my research has been when I was part of the Canadian Arthritis Network. So this was a network that I was part of when I was doing my master's degree. And the goal is that they brought researchers and clinicians, but also patient partners to interact together and to plan research together. And so it was really kind of the first time that it showed me that patient partners could be engaged in research. And I met a lot of these people who are still collaborating with me to this day. So my patient partners had a huge impact on my research. So patient partner helped me to design the research project. They helped me to find a good research question. They also helped me to find which methods would be optimal to use with participants. They also helped me to recruit participants even, because many of my patient partners are part of patient organizations. And so they get the word out about the research. They help recruit people via social media, and also they help to disseminate the research findings. So they really have a huge role. They even, help us to actually find new research questions. So I think it's really, really important to engage patient partners. The difference between a patient participant and a patient partner is the fact that a patient participant participates in the research. So they're recruited, they have to sign a consent form. So you really have to go through all the steps to get research ethics approval. And then you can recruit them and they'll give you data for your research project. Whereas patient partners are really patients who are engaged in developing the research project and improving the research project. And so they're really part of the research team. They collaborate and they help you decide, make all the decisions in order to have the best research project possible. And then you'll recruit participants after that. I would really recommend all researchers include patient partners in their research. I think without patient partners, the research is not as good and not as relevant to patients in general. So I would really recommend that they go get resources online to try to see how to engage patient partners. And I think they really have to realize if they're ready to share the power with patient partners, they really have to also see if they can compensate them adequately for their services, because you really need to compensate them for the great work that they do.